initially talk about probably what successful aging means. So how people have defined aging, what is successful aging, what it needs to be successfully, having successful or healthy aging. And then we will talk about the topic itself. So what, as rightly be introduced, this concept of mind-body dualism, Cartesian mind-body dualism, which was there, a lot of debate has been going on, and now we know that the mind and body are not entirely different. So when it comes to successful aging, I think it's very important to understand how it interacts with each other, and it's very important because when it comes to strategies to probably prevent morbidity, or for example, for successful aging, we need to know this intersection in a little detail. So coming to the first part of what I intend to convey, we'll talk about what it means by aging. So when in the initial 2000s, if we saw a lot of literature from the US talked about how the number of people older than 60 is going to probably outnumber children for the first time in the history of the world, in the initial part of the decade, actually. And people then started realizing the importance of how we need to look into this as an important component. And although there's no one phenotype of successful aging which people have generally agreed on, one of the most key important ingredient for successful aging is cognitive and emotional health. A lot of literature is there for preventing or slowing, say, morbidity which results from physical illnesses. People have been talking about how important it is to prevent morbidity from physical illnesses such as cancer or cardiovascular heart ailments and other kind of arthritis and other kinds of ailments. And people have been successful in doing that. But we also have to understand that one of the rate limiting factor means what may actually be very relevant when it comes to aging is probably brain health. So that is what people are actually now recognizing. And that is the reason why mental health practitioners probably may play a very important role in contributing to successful aging. So that is what we need to understand. So how as all of us know, it's not that we live longer, but how meaningful our lives are, which is very important. So thus, longevity is just one part of aging, but it's not the ideal thing. For example, very few people would want to live up to 90 years if it meant that have to be living with something like Alzheimer's or functional limitations or residing in a nursing home with a lot of difficulties. Okay, so that is why we talk about quality. So initially, way back in 90s, when a landmark article was published in Science, successful aging. How was successful aging defined? Successful aging was defined as a continuum. Continuum means it started from normal aging, which all of us undergo, to something known as pathological aging. Pathological aging means we age with a lot of difficulties when it comes to physical health, when it comes to mental health, and that contributes to limitations. So that is why they conceptualized aging, what it means by successful aging. If I have to be aging successfully, that means I should be free from disease, free from disability which occurs because of the disease. The second thing is that I need to have a reasonable amount of physical functioning and cognitive functioning. And because of that, I need to be able to engage in social and productive activities. Probably these are some characteristics which tell us that we have aged successfully. Okay, so most definitions initially, when it comes to aging, they talked about physical functioning, but now we talk a lot about emotional health, cognitive health, and social health when it comes to successful aging. A very interesting, it's not a research, it's a survey which people conducted with this definition, whatever I told you, and they did it in Utah in the US, and they found that almost 80 to 90%, when we apply this definition of being free from disease, free from disability, being meaningful, meaningfully engaged in some kind of a social activity, and being productive and having a decent amount of physical functioning. People said that almost 80 to 90% of those between the ages of 65 to 75 years, and almost 60% of those older than 85 years rated their health as good, and they found that they were reasonably reasonably aging. And most of them were residing independently. As I told you, they had intact cognition, they engaged in good amount of social activities. And as I'm going to talk about, the delineation between emotional aging, cognitive aging, or physical aging is blurry. It's not literally separate. So we have to understand how all of these are probably interlinked with each other, and that is most important. So I'm talking a lot about cognitive aging. What do you mean by cognitive aging? Cognitive aging means I have to preserve my cognitive structure. Cognition means those aspects of the brain which deal with making meaning out of any incoming information. Okay, so I have to develop these faculties, I have to preserve these faculties, which allows an older adult to maintain a reasonable amount of social connectedness. And with that, I probably need to have a sense of purpose in life, and I have to function independently so that I can recover from normal disease or injury which occurs as a part of aging. So that is probably how we can define this. So we have seen a lot in psychiatry. If we take a lot of focus now has shifted towards the concept of outcome. We don't say that you have a disease, that means you're disabled. Like that, what we have also seen is that we are moving more towards functioning rather than telling that someone has arthritis, someone has a cardiovascular disease, someone has coronary artery disease or cerebrovascular disease. We really don't bother about that. So what we are looking at when it comes to successful aging is how meaningful our life is, and for that we need to have these kind of abilities. So is successful, what contributes to successful aging? And that is where I'm going to talk about the role of physical health, mental health, and how social health, how these three intersect with each other to contribute to successful aging, and what we need to do probably to maintain that. And is it genetic? Many people have asked, in fact, that is aging, this concept of aging, is there a genetic basis for it? Yes, there is a genetic basis for it. And people say that almost 20 to 40% of variation of human lifespan is by genetics. What do these genes do? These genes, there are no genes for aging. There are no genes which tell us that because of this, you're going to have a longer life. These genes probably confer a vulnerability to disease. Some of us are more vulnerable to disease, and some of us are less vulnerable to disease, and that is how probably some of us tend to live longer, some of us, vice versa. So now that I talked a little about aging, we will now go to understanding the link or intersection of physical and mental health when it comes to aging. So aging is a natural process. I told you what it means by aging. Okay. And we are going to understand that there is a bidirectional relationship between physical and mental health in aging. What do I mean by bidirectional relationship? That means if I have a physical ailment, that I am at a risk for developing mental health issues. Vice versa. If I have mental health issues, that contributes to physical health issues. That is why we are not looking at both as separate. And now if I end up having one, then my chances of having the other is probably more common. And that has an impact on how successful I am in maintaining my functioning. Okay. Now let's talk about the first part of it. What is the impact of physical health on mental well-being? So does physical health have an impact on mental well-being? As all of us know, as people grow older, they age, they are much more susceptible to a lot of lifestyle diseases, chronic diseases, physical limitations, and things like that, which definitely can have an impact on mental health. For example, we know that as we grow older, we are prone to cardiovascular diseases, and then a lot of disorders like arthritis and things like that. Let us talk about some of the important things. Most chronic illness are associated with depression. So if we take certain common conditions like heart disease, if we take diabetes, if we take arthritis, all of them are associated with depression. Why? Why should it be associated with depression? There are a few reasons for that. Older individuals with chronic diseases have loss of independence because of illness. That's the most common thing. So if I have arthritis, then I probably will be unable to participate in social activities. I will be unable to do things which I would be doing in my everyday life. And thus that leads to feelings of helplessness, maybe frustration, maybe I would withdraw from my friends and things like that. That will make me all the more sad, all the more feeling that I'm incapable. And that's a vicious circle which goes on and on. So that's one reason why this loss of independence in chronic diseases can contribute to this depression. Second thing, a lot of these diseases are associated with pain. Okay, so pain is a common condition when it comes to any of these chronic illnesses I told. When we have pain, then my engagement in enjoyable activities decreases. The focus is to decrease pain. What can I do to decrease my pain? And so that again leads to depressive symptoms. And certain diseases, for example, if I say diabetes, if I take coronary artery disease, these are associated with some hormonal changes. It is not just loss of independence. It is not just that I choose not to do things. We have to understand that there's a common vulnerability. There are certain hormonal changes. For example, people talk about hypothalamo-pituitary adrenal axis and all these things, which we will not talk about. But we have to understand that people who have chronic illnesses also have certain inherent biological vulnerabilities, which is more likely to make them depressed. So that is something which we are knowing today. There's a lot of research which is happening, and that predisposes to depression. And also, a lot of these chronic illnesses, you see that people maintain dietary restrictions, the stress of disease management. Okay, if we take lifestyle disease, it's not going to last for 1 or 2 days. It's going to be there with someone. That leads to anxiety. That leads to a lot of emotional distress. That is why if we take diseases such as diabetes, the prevalence of depression can be almost up to 50 to 70%. That means out of 100 people with diabetes, 50 to 70% have depression at some point of their lifetime. Now we will slowly understand why it is important to recognize this depression, manage this depression so that I probably age better. Okay. The second part of it. So I talked about these chronic conditions and how depression is associated with it. We are talking about how the physical health has impact on mental well-being. Okay. Second thing, as we now know that people, the mean age of survival at birth is increasing every day. So when we take pre-independence era, with the average lifespan at birth was less than 50, and today we know it's 70 plus in India. And if we take nations such as Japan and other things, it's much more. It's more than 80. And we know that when people are going to survive longer, neurodegenerative diseases such as Alzheimer's disease, Parkinson's disease, this is going to increase. These are not genetic. These are not genetic. These are conditions which naturally come to people of when they live longer. Not all of them get affected, but yes, you live longer, then the risk of having these are much more. Now, what happens when people have these kind of diseases? Most common symptoms, as many of you may be knowing, are memory loss. Okay, they also struggle with managing day-to-day work. They don't know how to, they find it difficult to plan, to execute tasks, to prioritize tasks. All this is very difficult. So when people face this, suddenly they feel that they are not able to do things which they were able to do. So we have a lot of people who are functioning really well before the retirement. For example, government officials, bank officials, and things like that. Suddenly coming in with these kind of cognitive impairment and telling us that they are suddenly unable to manage their life. Suddenly they can't remember things, they don't know to do things which they were doing it so easily. So, before the onset of these problems. And that leads to a lot of emotional instability and psychological distress. Okay. And when it comes to Parkinson's disease, we have to understand many a times people can develop depression even before the onset of Parkinson's disease. We call it premotor symptoms. Okay. So these diseases of the brain can be associated with a lot of psychological symptoms. And also, as this disease progresses, behavioral and psychological symptoms, such as sometimes being excessively aggressive or sometimes not interested in day-to-day activities, all that also increase. So that is about how I talked about physical illnesses and how that is associated with psychological problems. I talked about how neurodegenerative disorders which are exceedingly common in older population, that associated with, these psychological symptoms. And another important thing is cardiovascular health and psychological symptoms. People who have recently undergone, say, stenting, coronary artery bypass graft or stenting, all of these diseases are associated with almost 40 to 50% of having, depression, anxiety after people undergo this kind of procedures. Okay, so that's also excessively common, and that again is because of biological vulnerability and the kind of limitations which people have after developing these kind of problems. The fourth most important thing we need to remember, the fourth most important physical condition is normal sensory impairment when it comes to elderly. We know elderly can have slight difficulties in hearing, they can have cataracts, visual loss, and things like that. So what happens because of that is that they develop social isolation. They gradually withdraw themselves because they're not able to hear properly, they're not able to see things which they used to do. And that can lead to a lot of depressive symptoms, loneliness, and things like that. And many times visual impairment can be associated with decreased mobility. People don't move, they prefer to sit, and they become less independent. And we have seen that with visual impairment, people have increased risk of falls. And with falls, they can have a head injury and associated anxiety, depression, and things like that. Okay. So the first part of my talk, what I have conveyed is what it means by successful aging. And now we have talked about what is the impact of physical health on mental health. So we saw commonly occurring physical ailments in elderly, how they contribute to commonly occurring psychiatric symptoms like depression, anxiety, feeling lonely, and things like that. Now we'll talk about the vice versa. What happens when someone has these mental health issues? What happens to physical well-being? The other way around. Is it true? We'll just briefly look into that. The most important condition, mental health condition, which all of us face or in any part of life is depression. Okay. Depression is not just, we are understanding today in research that depression is not just an emotional condition. It has a lot of effects on the body because depression is associated with certain biological changes. It is associated with certain hormonal changes, associated with changes in the brain. All of that leads to a lot of complications. So to give you an example, people who have untreated depression for, say, a few years have higher rates of occurrence of heart disease. Very surprising. But then people have found that if depression is untreated, the rates of heart disease are much, much higher. And for those who are diabetic, okay, if someone has depression, and if I don't treat diabetes in depression, people can end up with complications because of that. That means they can develop stroke, they can develop heart attacks, they can develop kidney dysfunction. So this is also exceedingly common. Okay. And we also know that one reason I told you is because people have this biological vulnerability. The second reason is that people with depression they're less likely to probably adhere to medical treatments, isn't it? They are likely to forget medication schedules. They will not be adhering to healthy lifestyle choices, and that is another reason why people with depression have associated, can be prone to a lot of illnesses, physical illnesses. Let's talk about anxiety. Anxiety again is associated with cardiovascular risk. So elderly people who develop anxiety for first time, a lot of anxiety, and that in fact people have in research have found that it is associated with atherosclerotic burden. That means they have higher risk for heart attack, they have higher risk for stroke, and things like that. Okay, that may be because of metabolic and immune causes and all of these. So we also know that that's why untreated depression, untreated anxiety have association with these physical ailments. What about cognitive decline? I talked about these neurodegenerative disorders. I talked about Alzheimer's. I talked about Parkinson's. People who have these have increased risk of falls. So because that may be because of the postural instability, impaired judgment, coordination problems. They also have they forget to take doses. They have drug interactions and things like that. Okay, and people with cognitive decline probably may not maintain adequate nutrition. Okay, that is again a reason why cognitive decline may be associated with a lot of physical health issues. So people with dementia are highly prone for a lot of physical conditions, such as, say, they may be prone for recurrent chest infections, they can be prone for skin infections and all of these. Okay, so we talked about how physical health can affect mental health in elderly. We talked about how mental health can affect physical health. Okay, now the third important part is how social factors, how both physical and mental health interactions have an impact on social life. Social life is extremely important. Okay, so we find that if people have these mental health issues, people have physical issues, they lack social interaction, they withdraw. And this social interaction, lack of social interaction, increases the risk of depression. Lack of social interaction is a risk factor for cognitive decline. It's also seen that people who are lonely are more likely to develop heart disease. They are more likely to develop strokes. They are more likely to develop poor immunity, recurrent infections. So that is why what people are doing in many countries is that they're engaging in community programs. Social engagement is very, very important. Engaging in a community activity, group activity, family support is very, very important, so that they have productive, meaningful lives, and also it has an impact on mental health and physical health. Okay, now a last part of it, it's also important that caregivers, many caregivers are also elderly, caregivers of those with dementia or other physical illnesses. And these people also undergo high levels of stress. And it's important that caregiver burden is also addressed in many of these conditions. Now that we know how physical health can affect mental health can affect physical health, how this can have a bearing on social life, how social life can have. So all these are quite, all these interact with each other in a very complex way, and that contributes to aging. So if we have successful, healthy aging. So now what do we do? It is inevitable that with aging, people develop physical illnesses. It is inevitable that physical illnesses, people develop mental issues, and that, a whole vicious circle happens, and then people have difficulties. So there are strategies which people are advocating so that people age gracefully, people age successfully. Okay, that is why people are developing holistic healthcare models. Holistic means we have to combine medical care, we'll have to combine psychological or psychiatric care, we have to combine social care. That means there is a lot of collaboration which is required between a primary care physician or a geriatrician, mental health professionals, including psychiatrists or psychologists or social workers, to provide comprehensive care, not just for disease, but also for aging health. That is exceedingly important. So what should we do? Okay, the most important tool is exercise. Exercise, people have researched, is a powerful tool in aging health. How does it help? How does exercise really help? I'll tell you how exercise helps. So exercise can reduce the risk of chronic disease. So walking half an hour a day, okay, doing a brisk activity if possible, reduces for almost 5 times a week, reduces the risk of chronic disease such as heart disease, diabetes, and bone health improves. Osteoporosis decreases. If bone health improves, then chances of having fractures when falling, so all that decreases. Now, with exercise, there is improved mobility. And imbalance is one of the most common cause of falls in elderly. It's not, and that is worsened by existing diabetes, existing neurodegenerative disorders. By introducing exercise into our daily activities, we can improve mobility, we can improve balance, we can improve flexibility, and risk of falls, injuries decreases. Okay, and exercise releases certain good hormones in the brain, and that reduces stress. And with exercise, people have found that sleep quality improves successfully. In elderly, we know that sleep tends to be fragmented, sleep time tends to be reduced, and by exercise, physical exercise, it can improve sleep quality. Physical exercise is one of the most important preventive factor for dementia. So, apart from cognitive engagement, which I will be talking about, the other most important thing, okay, which reduces the risk of dementia is probably exercise. So what kind of exercise you can do? Exercise can be aerobic exercise. Aerobic exercise means walking for half an hour a day, if possible, if there's no other arthritis or other condition, cycling, swimming for some time. That improves cardiovascular health. So cardiovascular health, people talk about this. People, it's important in elderly, there's a loss of muscle mass. As all of you know, muscle mass decreases in elderly. So that is why strength training can help in maintaining muscle mass. Okay, it can help you prevent falls. It can help in decreasing diabetes. So that is why strength training by using, say, commonly available things like light weights or resistance band definitely helps. The third important thing is balance exercises, balance and flexibility exercises. Like, for example, simple things like yoga asanas, stretching. What does it do? It helps in reducing the risk of fall. And also pranayama and things like the mindfulness. We talk about mindfulness-based interventions today in psychiatry. Okay, mindfulness means a simple form is pranayama. Okay, that in fact improves relaxation and well-being. Okay. And the last part of it is social physical activities. It's very important. What I mean by social physical activity means people today have group fitness classes. Say, doing this in isolation versus doing it with people. Why that is important? Because it, in addition to benefits of exercise, it also helps someone combat loneliness. It promotes emotional well-being. So that is why exercise is one of the top one intervention which is important for all these factors. It's not just physical health, it's also emotional health and also social well-being. After exercise, the second most important thing which we'll have to do is cognitive engagement. What I mean by cognitive engagement is mental stimulation. Okay, one of the key factors when people talk about aging is what we call cognitive reserve. Seems to be a complex term. I'll tell you what it means. Cognitive reserve means how much cognition I have, how much have I utilized my brain, or how much the brain has a function called plasticity. It's called neuroplasticity, wherein how much you use the brain grows, it becomes so flexible. Okay. If we enter senescence with a higher level of reserve, then my chances of developing cognitive decline will be less. So that is why it is important that mental stimulation is one of the most important things for maintaining cognitive function and to prevent neurodegenerative disorders. So what people are doing in certain countries like Japan is to actively engage in certain cognitive training programs. So here, though we are not doing that, people can do something like, reading books or crosswords or writing journals, your everyday thoughts, what you do, how are you feeling? Okay, reflecting on your own thoughts that day, feelings that day, what you do that day, all that can keep the mind sharp, apart from puzzles, Sudoku, and things like that. And many of us feel that, once we reach a certain age, I don't think you can learn. No, it's wrong. The brain has the capacity of plasticity till we live. So it is many people are engaging in lifelong learning programs. So I know a relative of mine who is learning Sanskrit at the age of 68. So he has passed 3 exams, and he's very happy about it. That's also giving a sense of well-being in him. So so these are certain strategies that we enroll in new programs. It can be technology-based, it can be history, it can be music, it can be anything, painting, creative activities like that, crafts, gardening, all these. Apart from cognitive engagement, it can also help us being it can help us in emotional fulfillment. We feel emotionally good, and it also helps us in mental engagement. Okay. The last thing what to do for cognitive engagement is use of technology. Today we have smartphones, we have social media, all of them have digital games. So most of us use smartphones for talking, communicating on WhatsApp, seeing something on YouTube. That is not cognitive engagement. Cognitive engagement is doing something wherein we actively use the brain. We are passively we are watching something or listening to something. So when we use technology, playing certain digital games or things like that, so all of that can help us. In fact, because technology is an inevitable part of life today, so we can use it to our well-being. So the second most important thing apart from exercise is, I told you, is cognitive engagement, or keeping ourselves cognitively fit. So that enhances cognitive function, improves self-esteem, reduces risk of depression, and that again is very important. Third thing is diet. Diet is very important for both physical and mental health. What do you mean by diet? Diet means I need to take some foodstuffs which are important to prevent something. So we need to understand that. Why should we do that? We need to do that because we have to prevent illnesses such as hypertension, diabetes, osteoporosis, and things like that. Second thing, it can support brain health, and it can reduce the risk of cognitive decline or dementia. And certain diets are known to improve mood and energy levels. Okay, so what should we eat? We should eat a diet rich in fruits, rich in vegetables, rich in cereals and whole grains, rich in nuts. Okay, that is very important, which can support heart and brain health. And there's a lot of talk about polyunsaturated fatty acids or omega-3 fatty acids. So it is found in nuts. Okay, and people who eat non-veg, it's found in fish, and that can help reduce inflammation and improve cognitive functioning. And it's very important that elderly take a lot of protein. That's important because we need to maintain muscle mass. Okay, and hydration is very important. So having a lot of fluids, especially in those who don't have major kidney disease and or heart disease, wherein hydration needs to be, water intake needs to be reduced. We need to adequately hydrate ourselves, which can help in maintaining a clear kind of cognition. It helps us prevent confusion and things like that. Most importantly, reduce processed food in canned food and excess sugar, carbohydrates, because that again can increase inflammation. So engage. The third most important thing I told you, first was how exercise and how it's important. The second thing is cognitive engagement, brain stimulation, what kind of activities you do. The third thing is mainly about diet. The fourth important thing is social engagement. What I mean by active social engagement means I participate in activities which makes me feel I have social engagement. I am doing something meaningful. It's very important because it can lower stress levels. When I know I am with someone who can listen to me, when I know I am with someone who can understand me, okay, that contributes to lesser risk of depression, anxiety. That improves cardiovascular health. That provides a sense of belongingness. Many a times, elderly are at a stage where they lose someone in their life, and at that stage, the things start declining. So people start developing physical ailments, depression, and things like that. And that is when social engagement is exceedingly important. What people can do is volunteering. So if many of you are good at many things, so you might have done wonderfully well in your life. So use that to give back to the community. That can give us a sense of purpose and fulfillment. It can be for 1 hour, 2 hours a day. Okay, and participation in activities, cultural events, and things like that. What people are also doing is something called intergenerational programs. That means many of us tend to engage with people of our own age. Okay, intergenerational programs means I can engage with younger generations. I can mentor someone. Okay, or it can even be childcare. So these intergenerational programs are exceedingly enriching because I feel I'm contributing something to a growth of someone who's younger. That is, that contributes to mental well-being. So I talked about 4 important interventions for aging. So one of this, I talked about exercise, I talked about diet, I talked about cognitive engagement, I talked about social engagement. These are very, very important things. The last most important thing, as I told you, is mental health support. I told you mental health conditions such as depression, anxiety are all exceedingly common. And if that is there, then the likelihood of having physical illnesses are exceedingly common. So that is why I need to routinely screen. My doctor has to routinely, whenever we go for a checkup, apart from checking for BP, apart from checking for sugar, diabetes, or any neurological condition, arthritis, screening for depression, screening for anxiety, screening for cognitive decline should be done. That is probably what people are talking about. Support groups again help. So if people having say cancer and malignancies, connecting with someone, that can also help. So therapy and counseling, psychotherapy, counseling, and integrating that into aging, that also exceedingly helps. So apart from that, all this are about treatment. Preventive health also is quite important. Preventive health means screening for something before they actually occur. So elderly need to undergo regular medical checkups to monitor chronic conditions. So don't neglect your physical conditions, because that can contribute to accelerated aging and problems. Sometimes in other countries, they give vaccinations, regular vaccinations, such as flu vaccine, pneumonia vaccine, and things like that. That also helps. And as I told you about sensory impairment, get your eye checked, get your hearing checked, correct that. That will make a huge impact on your, social life, emotional well-being, and things like that. Even dental checkups are so important, actually. And bone mineral density scans are done very commonly in other countries, but here we don't do it because that's important again to prevent osteoporosis, falls, and suddenly decline can happen. So when we talked about interventions, I talked about exercise, I talked about importance of cognitive engagement, I talked about diet, I talked about social engagement, and then I talked about how important it is to screen for psychiatric issues when you go to a general checkup. And I also told you how preventive healthcare is important and getting checked for hearing, vision, dental, and all that. By doing all this, an integrated approach to aging health is important. I'm emphasizing that again and again, that we need to have an integrated approach by recognizing the connection between a physical well-being and mental well-being. So what I have to do, I need to basically do regular physical activity. I need to cognitively engage myself. I need to have proper nutrition. I need to have social engagement. I need to have access to mental health care services. I need to have preventive health care. And I do this, then older adults can lead a healthier life, more fulfilling lives, and that contributes to a sense of purpose in life and well-being in life. Okay, with this, I think I conclude my talk. We can have questions if possible.
Shivam, can I just talk?
Yes, sure, sir. I also had a few questions.
Please go on. Please go on.
Yeah. You're asking first.
Yeah. See, in fact, I should congratulate Doctor for an excellent presentation on 6 aspects of life. So thank you, Doctor. That helps almost
thank you.
Learn how important every aspect of life is. That's right, Doctor. Thank you. See, but one thing is that, okay, that's engagement in all these things. Supposing there is somebody meets with a failure in one front or in another front. Say, for example, somebody is having a disease that for which they do not have a satisfactory solution. Will that by itself not cause a kind of mental imbalance? Will that not be responsible for a rundown in the health? That's my only question, Doctor. Thank you.
Yes, sir. Definitely, yes. As you're telling, yes. So people, sometimes there are some physical health conditions for which we can have probably prevent decline. It can be certain visual conditions. So people have some age-related macular degeneration and kind of things in the retina that doesn't have a cure. And definitely we know that people are going to have a decline in vision. And that, in fact, definitely is going to have a bearing on mental health. People with age-related macular degeneration or some kind of retinal issue, they're going to less likely indulge in walking, physical exercise. They are not going to interact with people. They're not going to eat well. And so, as you rightly said, how one condition can lead to changes in all of these domains and can lead to functional decline. So, yes, as you rightly said, sir, there are conditions which do not have cure, yes, but still people, that's why people are talking about how to successfully not treat that, but combat that and yet lead a meaningful life.
Yeah, that is exactly the question. How to go about with that? See, many of us are faced with such a condition.
Yes, yes. So I think it's about, again, say I take the same example of age-related macular degeneration. I'm not able to say my vision is declining. I have limitations in walking. I have limitations in probably writing and things like that. But I'm good at music. So what I can start doing, probably, I feel at that point, which may be helpful, is to start, say, a free music class for children. Okay, for maybe 2 hours a day, and then see what happens to my life. So that small change in life, by doing engaging in an activity, intergenerational activity, social activity, that will make me feel, in spite of having this visual impairment, I am still able to be meaningful. I am still able to be productive. I'm making a change in someone's life. So that contributes to a sense of well-being in me, though despite having this condition, which may not necessarily have a cure.
Yep, I understand. Slightly, we'll have to reorient ourselves.
Yes.
So things on which we are good.
Yes.
Rather than concentrating on things that we are not able to be good.
Right. And the other thing is, yes, that will contribute to a lot of distress. That will contribute to a lot of feeling that I'm no longer productive. I was like this. I was like, now I'm not being able to be productive. Yeah, again, access to mental health care there. So one part of it is doing some activity which will make me feel more productive, which will make me feel that I'm connected to people. And second thing is, what do you do about these thoughts? So there are mental health interventions where we can modify these thoughts so that we can accept what has come. So there are treatments, mental health treatments available. So by combining these, we make peace with ourselves. That is probably more important.
Thank you, Doctor. Thank you. That was that we are at peace with ourselves. Therefore,
yes.
Concentrate on this. Thank you.
Yes, sir.
That helps, Doctor. Thank you. Thank you.
Yeah.
More of like acceptance. Like we target an acceptance and commitment therapy.
Exactly. Right.
Sir, you talked about vulnerability.
That
how mental health conditions pave the way for physical health condition vulnerability and vice versa. So how can we tackle this vulnerability? How can we build our stress resilience so that these daily or adjustment issues don't take a toll on our mental health and ultimately go towards physical health?
I think that again boils down to strategies for successful coping, adaptive coping, or building resilience. So that could mean, say, it could mean accessing social support. It could mean using spirituality for some, okay, or it could mean other adaptive defenses like doing something productive for someone. Okay,
yes, sir.
These are things which I feel will probably improve coping and build up resilience in someone who's already vulnerable. Say, for someone who's already very sensitive to criticism or whatever it is, for someone who's very emotional and who's undergone a series of, who's now entered 60s or 70s and now has interpersonal issues like loss, grief, and things like that. I think that again boils down to successful coping and how resilient they are, and that probably depends on these, is what I feel.
Yes, sir. And I do believe that talking about spirituality, like WHO also defined health as a complete state of physical, mental, social, as well as spiritual well-being.
Health, yes.
So can we say that the spiritual measures such as joining any spiritual club or devoting, connecting with the larger faith, it helps us to build that vulnerability and gives us a state of support that there is someone like a God who is I'm not alone.
I think it definitely helps. Spirituality basically means connectedness. If you go to the core of spirituality, it all means how connected we are. And if you take any spirituality, so spiritual, you take spiritual classes, whatever kind of it, they all emphasize on interconnectedness. So, and the difficult part of it is how someone is spiritually inclined. So that again limits spiritual engagement. So people have found that if someone is not spiritually inclined, then someone cannot be forced to be spiritually inclined or forced into these classes. So that there comes a difficult part of it. So that's like how we do in mindfulness also, mindfulness or things like that. So if someone doesn't have the inclination, then any kind of meditative practices become very difficult.
Yes. We need a good source of inspiration, like a good spiritual leader.
Yes. So that also depends on early formative years and how what role models have shaped them in their lives, and that contributes to spiritual inclination. So if they are spiritually inclined, then spirituality plays a very key, very important part to successful coping when elderly, is what I feel.
Sure.
Thank you.
I request any other participant.
There are some questions in the chat box.
Yes, sir. I'm seeing.
Yeah, please.
How do we build?
Most of the questions you have answered.
Okay, sir. So how do we? Yeah, tools and tricks. How do we come out of the mental and physical integration vicious cycle? How do you? Can you suggest some tools and tricks? I think I told you about what are the interventions, physical interventions, cognitive interventions, interventions when it comes to mental health. I think it depends on integrating all these three. Depressions are artificially created by spouses, children, friends, relatives, lastly, communities around. I think here it all depends upon perception. So it is inevitable that stress is a part of life, and it all depends on how we perceive it. And how we perceive it is probably shaped by genetic influences as well as early environmental influences. So if someone is by nature sensitive, by nature very emotional, they will continue to be like that, and that's not entirely wrong. So the problem here is how we perceive that particular incident, or what people do to me. Again, that depends on how we modify our perception and feeling that yes, people may be doing this to me, but then I choose to do what is good for myself or what is best for myself. So that is probably what we mean by how we modify our way of thinking. So that is what we need to do, because we cannot necessarily prevent these things. It just cannot be prevented, is what I feel. Yeah. Sometimes a short-term memory loss for seniors. That's actually very relevant. It's not just for seniors. We have seen that in middle-aged adults and many of our students also, that they forget names, forget things post-COVID. We don't know what it is. People are talking about a lot of post-COVID accelerated cognitive decline and things like that. But then what will help is, again, as I told you, cognitive exercises. The list of cognitive exercises I told you. So the more we train our brain, the less likely that we are to the chance of losing our cognitive functions. So that I think is more important. Certain other things like writing down every day for elderly. Writing down is a very useful thing to do things, what has to be done, thoughts, all that keeps, a visual perspective or visual note of all this will help. These are memory aids which will help. So those things also can be done. And anything else? I don't think anything else. Any other?
In terms of, I think one or two people have raised hands. Mr. Tangaraja has raised hands. Mr. Ganesh has raised hands. We can ask them to unmute and speak.
Mr. Ganesh, would you like to ask any question?
Sir, unmute yourself, sir. can unmute, sir.
Yes. Doctor
Okay.
has.
Hello. Yeah. Okay.
Sir,
Tangarai sir. Tangarai sir, you proceed. You proceed.
yeah, please ask, sir. Tangarai, sir.
The doctor has answered my question. Depression is being created by somebody, particularly for about the seniors. They are living lonely. Nobody is honoring or sometimes they are insulting like this. How it can be prevented? He has answered. It's a perception he was telling.
Yes, sir. I know these are ways of thinking which will help us. So it's not. I'm not trying to tell that. What
Even
doing
if
is.
keeping quiet, but they are unnecessarily intervening and advising not to go there, not to speak with them, not to do that things, not to do these things. These are all invited by the seniors.
I know. Yes. Thing is.
Intervention.
Yes. Yes. Interventions again. We cannot do anything to modify the situation. In the sense, we cannot. We don't have control over what other people do, but we have control over how we think, what actions we take. So it's very important that we focus on what the controllables rather than the uncontrollables. So if we tell ourselves that we choose to take what they tell, if we choose, we can choose to tell ourselves that what they may be telling that, but then it may not necessarily be a fact. I do things which make me feel good. I do things which make me feel productive, satisfied. And I focus only on that.
But you have mentioned intergeneration like that. We can associate with the younger people.
Exactly. Yes, sir. That really helps. That makes us feel that we are contributing something. That's why.
How we match?
Yes, sir.
How it will match? When we say they won't hear.
Yeah, I know. So they won't hear, yes, but then you can use what you have learned. So you may be good at something. So you teach that to youngsters who are willing to learn. So
yes, I would like to interact with them.
Yes.
About sharing of experience like that.
Yes. Yes.
In a right way.
Yes. So again, that depends on how they are. So there are youngsters who are willing to learn. So it all depends on how receptive they are.
Somebody says it's a generation gap.
Generation gap will exist, definitely will exist. So we cannot go and advise probably youngsters to do that. But then teaching them a specific skill, teaching them a specific thing, people will still be receptive.
They are only suggestions. Yeah, he can take any decision on his own.
Yes, sir. Your voice is breaking. Hello.
Sir, one thing that will help us is totally non-expecting result. We just do our duty and stop at that.
The choice is ours, sir. That is to react or not to react. This choice is ours. Sir, I just want to continue your Jambunath's point only. I wanted to share one experience. One of my colleagues' father was 92 to 93. His eye vision has come down like anything, and he has almost 95%, 98% eyes vision has gone. But he never took it. What he do is, early morning by around 6 o'clock, he'll ask his son to take to some plain ground, and he'll walk very fast. At least for half an hour he will walk, because there is no obstruction in the plain ground, and he will proud, see, without my eyes I have walked today. So with that satisfaction, so he is not able to that he is really not feeling that he is not having eyes. Every day he does it. I just want to share.
Right.
So despite the cognition difficulty, how do we overcome is our choice, actually. I have seen him. Correct, I have seen him physically. Just I wanted to compliment what Jambunath was telling, and your answer was, and your presentation, your talk was excellent, sir. The tools and techniques are really excellent.
Thank you, sir. I think we have. My father's this thing. He used to go to learn certain rituals, actually, or what I say, mantras and things like that. I won't go into the detail. So that particular teacher developed progressive blindness. So even when he was having almost near complete blindness, he would still continue to teach. And that was one activity which kept him productively engaged and that made meaning in his life. So last few years he had near total blindness, yet he continued to do this.
Teach, yeah. You use other sensory arguments to get satisfied.
Yeah, yes. So
I mean, sort of gratitude, attitude, and offering back to the world or things like that. Yeah.
Yes. So that's why I think it's not that we need to aim not to have diseases. Many a times it's an inevitable part of it. We can also aim to control diseases which are under our control. For example, by walking, doing things, we can prevent diabetes. But there are certain diseases which will still come. That's okay. But even despite that, what can we do so that we engage ourselves in a productive, meaningful social life? That is what we need to aim at.
That's the one thing, only one thing I have doubt is that we are talking about all these things only to people who are more than 60 years. Probably aging starts quite early in life. Probably
that's yes, totally correct. Yeah.
Childhood. So that we create a society which is more healthy. Am I right?
That is totally right, because today we are having, I think your age, sir, diabetes used to start after 60. Today we are seeing that type 2 diabetes is starting in the second decade. In teenagers, we are seeing obesity, diabetes. And that we know, as I told you, is a risk factor for cognitive decline. It's a risk factor for depression and things like that. That means we are going to see accelerated aging in the next few generations. So that means all this is going to be true by 40s, 50s. It's not necessarily that we are going to see that post 60s. So to prevent that, what are we supposed to do? So we probably have to change lifestyle, and that is why all this, so that we age, meaningfully and successfully. That is very relevant.
It starts at school level itself.
Yes, sir. Totally. Yes. Because children, children even today in school level also we have seen children with obesity. So they're giving chips, they give pastas, they give pizzas. So that itself, that is the point where they start developing cellular aging and nutritional problems and lot of other complications. Today we are seeing rise in ADHD, we are seeing rise in behavioral problems in children. All that is because of this. We don't know what is going to happen with later on in life as they grow old. It's going to be very scary if you think about it.
That's true, doctor. That's true. Thank you, doctor.
Yeah.
So, presentation. Once again, I offer my compliments to you. Thank you. Thanks.
Thank you, sir. Thank you so much.
Any other question we have from any participant?
I would like to ask a question.
Yes, madam.
With this awareness, we are now at an intersection ourselves at this time of our lives, especially for those who are in their 70s. So, and we have and thank you very much for your very, very comprehensive talk and explanations at all levels. But with a big giant like NIMHANS, we can hold, even online courses for people prior to retirement, 50 years onwards, or, at least for them, those who are going to get into it, to start, giving guidelines of all these things. And we have such a rich culture in our country, with Hindutva, you might say, with all the discipline and the, the spirituality being so part of our lives. And especially, so there can be so much more awareness, even online with payment also, even in schools, companies, everybody prior to retirement can have these courses and pay for it and make this, even people pay for it, some nominal charges, so that they come and make compulsory. Now the university, I'm in Bangalore, they have made it compulsory for students in the colleges to give 20, 40, 60 hours of a community social service.
Right.
And can be more utilized by maybe some NGOs or private establishments or hostels or ashrams or things, or even old age homes, or different places like that, or even where there are gatherings of old people together, or even the young people to create this awareness, and the students also are being made more aware of it, I think, because of the university making it compulsory for any form of community service. And definitely many of them are approaching in with the seniors now. But of course, the seniors also have to be, as you said, socially inclined to interact, inquisitive,
Yes.
curious, and healthy also.
Right.
But thank you very, very much for your really wonderful lecture, Dr. Shankar.
Thank you so much, ma'am. I think all that you said is really valid. I think we need to make a link between, children, adolescents, and elderly, so that this kind of link really helps.
Yes.
Because
Yes, one point I want to raise up is the cultural changes. Like we know, India is traditionally a collectivist society compared to the more Western, which may lay more emphasis on the individualistic societies. But now we see that in India also, the joint system of the family, that knit system of the village social bonds, that collectivistic community is giving way to the individualistic societies, which makes the elderly more vulnerable to social isolation or loneliness in the old age. So, connecting the elderly with the younger populations in this era of cultural change might help the elderly in coping up with this social
yes,
issues.
definitely. I think breakdown, as you rightly said, breakdown of families, traditional Indian families, is one of the most important risk factor for social isolation at any point in lifespan, I think. And that is contributing to a lot of mental health issues. As you rightly said, I think that's a very important point.
Yes. One last question I had, Doctor.
Yes.
Like we talk about the biopsychosocial model, that how these three domains influence each other. There's also one very hot debated topic going on these days, that is psychoimmunology, that
Right.
our mental health influences our immunity also,
Right.
which helps us prevent many infectious and chronic
Yes.
diseases.
Yes.
So what is the exact mechanism that our mental health, our mental stability works on the white blood cells and whatever those agents of immunity are there in the body?
I think that's quite important, because as I already told, the links between, say, depression and coronary artery disease, depression and, say, stroke, okay, all these are one of the most important mechanisms is psychoneuroimmunology. So it is believed today that there are links between brain, okay, and the immune system. There's an intricate link. How it happens is, if I have to give an example, people, if you say they're writing exams, they're taking something, they're more vulnerable for infections. So if we see that in children, as they take an exam, they get colds, they get diarrhea and things like that. And one of the main mechanism is the link between the brain and the immune system. So it is seen that with chronic stress, there is atrophy means there is shrinkage of certain parts of the brain. For example, the hippocampus and things like that. So once that happens, what happens is the hippocampus usually plays a role in damping down certain hormonal levels. So all of you must have heard about cortisol or steroid levels in a body. Okay. So this part of the brain helps in decreasing that. So with stress, what happens? The part of the brain which controls this axis, the steroid axis in the body, that is reduced. And so steroid axis, HPA axis dysregulation, what we call steroid axis, becomes more active. And once the steroid axis becomes more active, that leads to changes in immunity. So when there is an infection, when there is something else, the immune system is less capable of defending it. Yes. So it is not just that, but these changes also happen when it comes to platelets and the blood vessels and how efficiently clots are formed and things like that. So people who are in shift work, or things like that. It is seen that people who are in shift work are more prone to develop heart attacks, more prone to develop strokes, and this is one mechanism. Okay, so there's an intricate link between stress, immune system, and these hormonal levels, and that contributes to a lot of conditions like obesity, diabetes, and coronary artery disease, stroke, and things like that. So that's why they say it's important to address stress, chronic stress, manage it with whatever strategies. It can be coping, building resilience, it can be mindfulness, or it can be, as you told, using acceptance, radical acceptance, as we say in acceptance and commitment therapy, all of this. So it is quite important.
Yes, thank you, Dr. Sir, for explaining and elaborating about all these concepts in such details and clearing of our doubts. And I guess respecting the time, we should be concluding this session. Jambunathan sir, any end comments you would like to give?
I have already said that no comments. In fact, it was one of the excellent lectures I have attended. In fact, we always say that body-mind is connected. But that body-mind connection, how it happens, what are all the 6 points on which the body-mind connection can be addressed, and how we can improve that. So all these things have been beautifully explained by the doctor in very, very layman's language. That's the thing. See, in fact, if people are going to talk on very, sophisticated languages and technical language, we cannot understand. We are already people. So doctor was down to earth level, and he was explaining everything in a beautiful layman's language, I should say. So thank you. I thank doctor once again for an excellent session. And doctor, this has opened our eyes on many friends that yes, we need to be aware of all these things. And there is not a single factor that contributes to health. There are these 6 points, all the 6 points contribute to health, and we need to work on that resilience. We need to work on that. And aging is something that we cannot avoid. So with this aging, what is that we can do to avoid our getting himself into some kind of a health issue? And as somebody was telling in the morning, I was listening to somebody, he said, till my last, I wanted to walk. Till my last, I wanted to take my bath. Till my last, I wanted to eat my food myself. So this is the kind of health that we need to build up on that, doctor. This is a very good foundation for that, doctor. Thank you very much.
Thank you so much, sir. Thank you so much.
Thank you.
Yeah.
Thank you.
Thank you, Jambunathan sir, for your inputs. Thank you, Shankar sir, for discussing in details all these concepts, and also to all the participants who joined us today and actively participate in the session. We hope to see you all in the further sessions as we conduct every Monday.
Yes.
Yes, and the
Thank you.
recordings I would be sharing very soon. Thank you.
Thank you. Thank you.
Thank you. Bye.